Hi there, I'm Maher Madhoun. I'm a physician. I live in Ridgefield. I've been living in Ridgefield since 2012. I am married and have three children, and all my three children are in the Ridgefield public schools. Um, I am a dual boarded physician. I practice both internal medicine and infectious diseases. And with both of those specialties, I've been essentially on the front lines since the spring. I work full-time at Stamford Hospital. That's where I have my practices. In addition to being a clinician, I also do a lot of administrative work. I've been involved in a lot of committees at the hospital, and obviously been involved in a lot of the planning and strategies along with taking care of COVID. I've been involved in the Ridgefield COVID task force now for the last couple months. I was asked by Rudy to participate, given my background in infectious diseases. How it came about was that my understanding is that they had developed a COVID task force, and I reached out to Rudy to see if he needed any expertise on that in his committee, and he reached out back to me, and that's how we sort of started talking, and he invited me into the committee, and we started working since then. It's been great. I've been working with a lot of members in the community who are very dedicated, and it's been an honor to work with Rudy and the COVID task force, and hopefully sharing some of my knowledge to help the community and others learn more about COVID and how to move forward from COVID. One of the things that I like to really talk about is the vaccine. It's a truly a major milestone in the fight with COVID. The vaccine that came out last week is the Pfizer vaccine. Personally, that's the one I'm going to be taking as early as tomorrow. We plan on getting our shipment of the Pfizer vaccine at the hospital tomorrow. There's another one called Moderna that should go through FDA approval by the end of the week and hopefully be able to be shipped to the hospitals as early as next week. Both of them are very similar vaccines. They're both called mRNA vaccines. It's relatively new technology on how to create these vaccines. And it does not use the traditional method of how vaccines were created many years ago. Prior vaccines typically used a lot of dead viral particles or even low-dose viral particles to create vaccines. This particular vaccine is very crude and rudimentary on how it works. It basically develops these antigens called protein spikes, which helps prevent the cells from COVID attacking and attaching to your cells and therefore preventing you from getting infected. The vaccines that are coming out on the market, both the Pfizer and Moderna vaccine, are in the range of 95% effectiveness. They're both very safe in their profile, and they work along all age groups, ethnicities, and genders. The side effects tend to be very mild, mostly with injection pain at the injection site, some fatigue, and some low-grade fevers. Those are generally very mild and go away fairly quickly. The vaccines that are coming out require 2 injections. The first, and depending on which vaccine you get, either 3 or 4 weeks after the first injection. The Pfizer one specifically is 21 days after you get your first injection, you need to get a booster. The Moderna one is nearly 4 weeks after you get the first one. Once you get the second injection, that provides almost all the immunity that you need from the vaccine. If you only get the one vaccine injection, it does not provide you with the 95% effectiveness that you need. It's much less than that. So it is strongly encouraged that you receive both of the injections when you get the vaccine. In terms of when can we resume living our normal lives as we were doing before COVID, it's to be determined. I am very hopeful by the end of 2021, we will be able to do most of the things that we were able to do before. It's imperative that we get a certain percentage of people who get vaccinated or who have immunity in order to do so, in order to go back to where we were prior to COVID. I think the government, both on the state level and the federal government, is really doing everything they can to try to expedite vaccine administration. And there's a lot of logistical challenges with that on which groups have higher priority than other groups. Obviously, in the first wave of vaccines, that's going to healthcare providers, people who work on the front lines, also employees, clinicians who work in the offices. And that's also now including people who are considered high-risk category. For example, teachers, EMT workers, police officers, firemen, etc. In that first wave, patients who are in long-term care facilities are also considered very high risk. Most of the deaths that we saw in the spring in this area, 50% or more came from residents of nursing homes. So it's imperative that we vaccinate that group first in the first wave. In the second wave, it's theorized that we'll probably be able to vaccinate the general population probably sometime in the March or April timeframe. Hopefully quicker, but March or April. We have to work out all the logistics. The next wave of patients who would be probably qualifying for this would be people over the age of 65 with or without comorbidities. That discussion changes week to week, but as of right now, I think the 65 and older population probably will go in the second wave. Some logistical challenges that we're working through on the vaccines is transportation. We've heard in the news that vaccines that are being given to the hospitals need to be transported in a very specific temperature range. And the Pfizer vaccine, it needs to be refrigerated at -70 degrees or lower, which the hospitals have capability of handling those vaccines. The Moderna is a little bit better, but there's still some logistical challenges. Those need to be refrigerated at -20 degrees. So the nursing homes are likely going to be vaccinated with the Moderna and the Pfizer vaccines. It looks like that CVS Pharmacy has been contracted to give the vaccines to nursing homes, and hospitals will be providing all frontline workers and first responders in the hospital setting. So there's going to be a two-pronged approach here on how to vaccinate the high-risk population. We still encourage people to wear a mask, even if you get the vaccine. No one really knows if you could be a viral carrier, even if you get a vaccine. You may not show illness, but you may carry the virus and potentially you could transmit it from one person to another. So in the interim, at least in the next 6 to 8 months, we really encourage everyone to continue wearing the mask to protect others from potentially contracting the virus. It's imperative. We know that mask wearing does now reduce the transmission of COVID. There's been now a lot of studies and case reports from other states in the United States to show that there is a transmission reduction on those counties and states that mandate a mask. Although it's an inconvenience, we certainly know that it does help. And interestingly enough, what we found out is it reduces the chance of transmission of other viral infection. For example, the flu. Where I work in Stamford, we have had essentially 0 flu cases as a result of mask wearing, hand washing, and social distancing. So there's an added benefit on wearing a mask is that you might not get sick with other illnesses that we would normally see in the wintertime. We are working closely with the schools. The CDC continues to change their recommendations appropriately on quarantine. They did come out with a recent recommendation regarding reducing the quarantine time to 10 days or potentially 7 days with a negative test. That, I think, helps the population adhere a little bit more to the quarantine. And based on the studies, after 10 days, you really are not shedding the virus at all. And therefore, your chance of transmitting becomes negligible from person to person. So we hope that people continue to adhere, again, with infection control processes, strict hand washing, social distancing, and mask wearing. I get questioned often about, would I take the vaccine? Is the vaccine safe? Are you worried about the vaccine since it was created too quickly? My answer is I cannot wait to get my vaccine tomorrow. The safety profiles are very evident. The studies studied tens of thousands of patients with little or no adverse events. And we've come a long way with how vaccines are made. So I encourage everyone, if there's any hesitancy, please talk to people who receive the vaccine so you get real answers on how they tolerated the vaccine. There's been a lot of misinformation on social media, but please try to read things that, or talk to people that you trust in order to get the appropriate information that you need. I want to thank the town of Ridgefield for all your support and all the letters of support that I've received. And I want to give thanks to Rudy for allowing me to participate in the COVID task force. I look forward to working with the entire town and the COVID task force and hopefully move forward as quickly as possible and enjoy life post-COVID. Thank you very much.